A Do Not Attempt Cardiopulmonary Resuscitation Order, DNACPR, is a document that formalizes decision-making about whether an individual should be treated with CPR in the event of cardiac arrest. It is a form of advance directive in the management of patients with progressive life-limiting illness, approaching their end of life, and significantly frail patients. Usually as a junior doctor, I have had DNACPR discussion with my patients in the hospital, and I did struggle in the beginning because it's a very sensitive topic to discuss about, and it's important to get familiar with this process of discussing DNAR with the patient, their family, or even their carers, how to complete the form correctly, and how to document the decision. Therefore, in this video, I'll guide you on how to effectively communicate DNACPR information with a step-to-step approach. First of all, when is DNACPR appropriate? CPR is an attempt to restart a person's heart in the event of cardiac arrest, which will involve chest compression, respiratory ventilation, defibrillation, and giving IV drugs. It is an invasive process and carries a lot of risks such as rib fractures and hypoxic brain injury. Remember, CPR is not appropriate for every patient who has cardiac arrest. DNACPR is only appropriate in cases where the potential risk of CPR outweigh the potential benefits. How do you initiate a DNACPR discussion? If you are a junior doctor, make sure to discuss this with your senior or consultant before deciding to discuss with your patients. These conversations ideally to be held in the presence of family members. It is generally helpful to frame the discussion about resuscitation as a part of broader conversation. What do they understand about it? It is important to explain clearly what is DNACPR, and having this conversation does not necessarily mean that you expect them to decline rapidly. Explaining DNACPR. Again, DNACPR is a decision about medical treatment made by clinicians and therefore does not technically require patient consent. It is important not to explicitly ask their permission to sign the form, as this tends to give a false understanding of how the decision is actually made. However, the guidance states that resuscitation should be discussed with the patient or a representative before the form is signed, and that they should be informed of the decision. This is in line with the General Medical Council's GMC's good medical practice. Opening the consultation. First of all, wash your hand, go in, introduce yourself and your role, confirm the patient's identity and their family's identity, explain in the beginning itself that you wish to discuss about resuscitation in the event of patient deteriorating and having a cardiac arrest, and make sure to gain consent. To explore their prior understanding, what is resuscitation? Do they understand about their current health state, including the sequence of events that has led to this point? I would usually first start what is cardiac arrest is about and what is CPR. Some fundamental information to convey during this conversation includes CPR is likely to be futile due to why, blah blah blah. Tell the reason. It's likely to lead to poor outcomes of the patients or something like that. It is important to emphasize it is specific to CPR as a treatment and does not apply to other interventions or treatments. Sometimes patients might misinterpret DNACPR as we are giving up on them or stopping their active treatment. So it's very crucial to make sure your patient understood fully of what you have just said. And before you close the conversation, make sure you check their understanding of the conversation. Invite them to ask any questions or concerns they have. And finally, I like to summarize what I've just said in short so that everyone is in the same picture. An interesting question. What if the family disagree with your decision? First, you should listen to their concern and address them through further explanation if you can. But if they are still disagreeing to your opinion, I would suggest as a junior doctor, you can always escalate this to your seniors or your consultant for second opinion. And finally, thank them for their time. DNACPR form may vary between hospitals. The following information needs to be filled up, such as personal details of the patients, contact details, reason why DNACPR order is indicated, and usually doctors below the registrar level, except foundation year 1 doctor, may sign the form, but it's always need to be countersigned by a consultant. It's always a good practice to communicate DNACPR decision to other members of the team as well, like the GP, the nurses, or even mentioning in your discharge summary. Conversations about resuscitation can be difficult and distressing for patients and their families, but with advanced planning and good communication, this can be a very positive process in many cases. Appropriate DNACPR decision making can help to ensure dignified deaths for the patient as well and cause less distress at their end of life.